Okay, I want to welcome everyone. We have so much to cover. I am so excited about this webinar called Fundraising, Making the Health Equity Case. Thank you all for taking the time to join today's webinar, Fundraising, Making the Equity Case. Before we go further, I want to mention that we are recording today's webinar. So if you miss a section or would like to pass it on to a colleague, and I hope you do, there's going to be a lot of great stuff here. You can find the recording by going to our usual www.campaignforaction.org/webinars. Back to our topic. I am so thrilled to join our two sets of speakers today. It's been a while since the campaign has had a webinar on fundraising, one of my favorite topics. So I requested it, and I like to join our technical assistants on fundraising when I am available. So here we are together, still sitting at home. I asked Wynn and the team to organize this webinar that could explain why funders are really, really ready to fund programs related to health equity now. And on top of that, you can use the National Academy of Medicine's report, The Future of Nursing 2020-2030, charting a path to health equity to help you pitch your case to funders. And that's why we're here. I like to say that even if you have the intent, if you go to that National Academy of Medicine website, we have policy briefs. We have all the right words for you to use to help make your pitches. So without further ado, and the people who are going to help you learn these points are two leaders, my colleagues, from the Blue Cross Blue Shield of Michigan Foundation, Audrey Harvey, the Executive Director, and Dr. Kelly Britton, their Senior Program Officer. Ms. Harvey and Dr. Britton will also provide excellent information on what to consider when creating your proposal. And after we hear why this state level foundation is interested in health equity, and believe me, there are so many places that are interested in health equity, including banks and the government, everyone. So after we hear the state level foundation and the other wisdom they impart, we will hear from Paul Leon. For those of you who don't know Paul, he is a nurse, is the founder and CEO of the Illumination Foundation in Los Angeles that finds housing and services for the homeless, and is a consultant to the Champion for Nursing, Center to Champion Nursing in America on health equity and nursing. Paul will also provide very important pearls of wisdom to help you build your case. Then he will describe how he uses the Nursing 2020-2030 report when he meets with prospective funders and their reactions. I'd like to hear that, Paul. I'd like to. For those of you who are listening, please add your questions to the chat feature, and please do that throughout. We're going to collect those questions and then I'll get to them at the end. Or be ready to ask them verbally or even in the chat when our presenters wrap up. So at this point, I'm happy to bring on our first speaker, Ms. Audrey Harvey, who will then turn it over to Dr. Britton. And Kelly, when you wrap up, how about if you turn it over to Paul, okay? Thank you for joining, and let's get started. Audrey.
Thank you so much. I have my camera on. Are you able to see me? Yes, very good. Well, thank you, everyone. And thank you so much, Susan, for this opportunity. I'm really happy to be here to share information with respect to how to positively influence your grant making. Next slide. I'm going to start just by sharing a little about Blue Cross Blue Shield. We're a 501c3, a nonprofit organization that is designated to support Blue Care Network, our parent company. And we were started by seed money of $800,000, followed by about another $20,000 that came from the Michigan State Medical Society. We have never received any funds from Blue Cross Blue Shield of Michigan, although we obviously share the mission, which is to improve the health of Michigan residents by supporting innovative health and research programs. We work together with two departments at Blue Cross, that being community responsibility, who you may have heard some about, and our social mission department, which also does funding for programs in the state. But the takeaway I want to impress upon you here is that we are a separate organization. Although we have the name Blue Cross, we have a separate governing board, and our funds have never been provided to us from Blue Cross. So we have a very different level of autonomy, as well as a much broader focus when it comes to funding. And that will focus both on research programs and intervention programs. And it is really important to understand, as approaching different organizations, to understand who their money came from and how they were started and how they're governed, so that you can understand, how to best make your pitch. Next slide. One of the things that I think is the most fortunate time for us to be having this conversation is that for most of you who are joining this call today, we're in a very fortunate environment in that most people now appreciate what you've always known. You've always known that there were health inequities, and maybe had a very difficult time stressing and sharing that information. So much information came to light with COVID, and there's continuous amounts of data that's being generated. And so I sort of feel like the public is primed and ready. And most definitely our boards and our executives and organizations are much, much more educated now than they ever have been. In the past, there's been organizations like, W.K. Kellogg and Robert Wood Johnson who have been leading this charge, along with grant makers in health, to help organizations focus on health equity and understand how to support organizations that were looking in that direction. But now I feel like having the data and understanding your organization and being able to craft how these social economic factors that we all know impact health much more than going to the doctors, which is what this slide here is sharing, is that the majority of our health is not impacted by going to the doctors. It's the social economic factors. It's our environment. It's the health behaviors. Only 20% is impacted by healthcare. And it is so rich now that the general grant-making organizations and their boards now understand this. The key then, as a person who's requesting funds, would be able to tie your request into the data that's available. Next slide. So the final thing I want to share before I turn it over to Kelly, who's going to give you more data, is why does it matter? And to me, it matters now because we're in a period of awakening. There has been so much data shared about health inequity. And when I listen to executives that I work with in other areas of our organization talk to me about social determinants of health, I will tell you, it makes my heart leap, because I feel like now people are beginning to understand. They don't understand it as well as those that work boots on the ground, working in healthcare or crafting interventions, but they have an understanding. And what I have found is tying your story to the needs and the data is what's very important. When you talk about workforce recruitment and retention, it has taken us at least 2 to 3 years to be able to help our boards and others understand how we could craft a healthcare intervention that would touch on both of those and how the social determinants of health are impacted by those. Unfortunately, our foundation does not work in policy, but we work very closely with those in the state that do work on policy and try to provide them with additional information. So I just want to say that the healthcare matters to funders, and more importantly, the boards are starting to get it, and the department and everything is just right for you to be able to use data and tie your stories together. With that, I'm going to turn it over to Dr. Britton to give you some more detailed parts on crafting applications. Thank you.
Hi, thank you, Audrey. So next slide, please. So how do you actually begin a search? I mean, it's pretty searchy. You're going to use Google, but perhaps you want to make a connection to grant makers in health, or you want to make a connection to your local Blue Cross Blue Shield Foundation. You may want to use GuideStar. GuideStar.org is a great place to start, but it can be unwieldy. To look for Blue Cross in your area, type in your search engine Blue Cross, Blue Shield Foundation, and add the state. And that should pull up the Blue Cross Blue Shield Foundation in your area or your region. And once you do that, you want to look at the mission and the vision of whatever organization you've happened upon for mission match. Like Audrey said, it's really important that you tie what you're looking for, what you're looking to receive funds for, to the mission and vision and values of the organization. And then after you find the mission match, you want to do an inquiry. So, you don't want to send in a grant application cold. And most organizations at this point have concept paper processes or some other ways that you are to engage with some of the program staff. One of the ways that you're going to look for who do you connect with could be in the frequently asked questions section. Some organizations might have the emails listed on their website. Sometimes you may even have to make a call to find out who's the right person to connect with. But when all else fails, use the contact us feature on your funder's website. Now, while you're trying to figure out who you're going to talk to, as Audrey said, that it's very important to know who you're going to talk to, as well as their funding mission and things about their board, you're going to comb through their website to actually create questions that you want to ask when you do get a chance to connect with the program staff. Those questions that you want to ask include about what's the grant making process, submission timelines, deadlines, amount of funding available, and the types of health equity grants they've funded in the past. I often recommend that folks have at least 2 ideas they want to float. And it's always good to ask if that idea gets a lukewarm reception, what might make that idea fundable? And it's a great question to ask because you don't want to waste time presenting an idea or submitting a application that's something that causes your organization to mission drift or get off course in what your goals are. So if you are then given the green light for next steps, how do you make your case? Next slide, please. So when working on your concept paper or application, there are key areas to attend to. In general, of course, you always want to make sure that you're answering the questions being asked or address the main points of the request for proposal. But specifically, most program staff are looking for 5 main things. The first thing is impact. Who is the population? What is the issue? What's the goal of the project? And when will the work be done? Next are partners. Partners are very important in all levels of grant making. Definitely always submit a letter of support. It may say it's not required. However, your application is much stronger with a letter of support. This is especially important when your partner agency or you're working with a vulnerable population or you're working with a community-based organization. Feasibility. Um, it's important to be reasonable with the money and the time allotted. This can be a problem area sometimes for universities because of indirect expenses or large percentages needed to be allocated on fringes. So that's why it's always important to understand what the foundation funds and what they will pay for. If they pay for capital, if they pay for equipment, if they pay for indirect expenses, and if there's a limit on fringe benefits. Sustainability, very, very key. It's okay to have a one and done project and not need future funding. That's a great project for some small foundations. And sometimes that's really all you need is to draft that policy brief, to do some legislative work. And sometimes those projects are excellent. Often when folks think of sustainability, they're thinking about additional funding. well, I would ask you to think of sustainability in a couple of more ways. Sustainability can also be a part of a plan for policy change. It is also a part of change in behavior, a change in practice, or a change in culture. When making your case about sustainability, um, be very clear and realistic about how long it's going to take. The last point would be evaluation. The evaluation of outcomes should always be measurable, match the goals and feasibility of the project, and also be very, very realistic. To measure real behavior change takes a long time and a lot of follow up. Perhaps it might be more relevant to measure knowledge change that may lead to later behavior change that can be done in a shorter grant period time. Also, be very clear on how the project will be evaluated and what are those measures of success. So, now on to how to use the Future of Nursing report to make your case. Next slide. Now, in using the report, there are at least two ways to use the full Future of Nursing report. One for data to make your case, and the second is for support for program development or implementation. Now, when you look at that full report with its beautiful 11 chapters, you might be like, okay, like where do I start? I recommend that you start the recommendations at a glance to give you an overview of what might be a good match for your organization and the mission of your organization to look at. And then go into your deep dive into the full report because the full report definitely has information to help you make that case related to impact and the significance of your project. Again, the report is excellent for data. You can dive into the 11 chapters or pick the chapter that most resonates with your organization. But I wanted to lift up a few key points within the report that are so user friendly. So, page XXV is page 25, but when you do page 25, it's going to come up at XXV. That's the list of boxes, figures, and tables in the report. Even if you started there to kind of see what is some of the data that's available, that's a great place to start. Um, there is in chapter 3 on the nursing workforce, there's several figures and tables in that section. In the summary section on page 5 and on page 27 in the introduction, there's a nice figure that's the framework for understanding nurses' role in addressing the equity of health and healthcare. Always, you want to cite some great reports. On page 393 is the list of the National Academy's reports used in the Future of Nursing report. And of course, these are state-of-the-art reports and very rich in what they prepare. Also on page 393 are two white papers that are cited, one on social determinants and the other one is on the nursing and payer system. And Appendices C has tables and gives step-by-step instructions on how to recreate those same tables that are featured in chapter 3 on the nursing workforce. Audrey mentioned something that is very important in terms of using data to make the case. Even though you have national data, you're still going to need local data to make that national case relevant for wherever you are. So that may mean connecting to your state government, regional healthcare systems, local healthcare systems, or other community health needs assessments that your hospitals or public health departments have produced in the last 2 years. The Future of Nursing report is excellent again for program ideas and project ideas for nursing organizations to address health equity. Again, you can begin with the recommendations or pick a chapter. Each chapter is so rich with literature and figures or tables. For example, chapter 10 on supporting the health and professional well-being of nurses is so comprehensive. It has not only a framework, it has a snapshot of physical health of nurses, as well as sections that address mental and behavioral health, moral distress, and many other factors that impact the health and well-being of nurses. Always in your application, you're going to strive to make terms that other non-nurses aren't familiar with very clear. Appendix D is very, very helpful with that. And also, again, going back to the recommendations at a glance might be a great supplement to add with your report. What I like to do now, we as nurses, we always transition from theory to practice or to clinical. And so now I'll transition to Paul. Well, he will give us a clinic on how he used the Future of Nursing report to obtain funding.
Thank you, Kelly. That was, I took so many notes because when do you often have a time for a funder to talk to you and explain to you how to write a RFP or a request? So thank you so much for that information. My name's Paul Leon. I am an ICU ER nurse, public health nurse, and now I'm the CEO of Illumination Foundation. I think it's important to know, when we're talking about data and about storytelling, to just break it down as nurses, as, people that aren't normally grant writers or people that have not been in the business world. So I just, when we started with Illumination Foundation, we actually started in my garage. And if I had to pick somebody who I would pick as the CEO, executive director, it probably wouldn't have been me. Because I thought of myself as a bedside nurse. I thought of myself as an advocate for our patients. And then as I started to realize that, nurses are the perfect people to be doing that job and to really advocating at a whole different level. So next slide, please. So when we start talking about, writing RFPs, seeking funding, you start looking at type of fundraising. And one of the things I learned early on is that you have to have a business model. You basically have to understand the plan. I think Audrey and Kelly outlined it perfectly, that you have to have a plan that's sustainable. You can't, I guess you could just write one-off RFP, one-off grant, but most funders and most corporations, they want to see a sustainable business plan that is running in addition to money that you're asking to. So being able to leverage outside funding with the work that you're doing is critical. And someone told me early on, which was an invaluable lesson, don't chase the money. If you're providing nursing care, let's say in housing, and your core group is, let's say seniors or children, and you've never worked with veterans, you probably don't want to just start out with veterans groups and writing RFPs and grants and seeking money for veterans groups. It's pretty much common sense that if you do chase that money, your program doesn't match what you're going to try to do. And then I guess the same thing true is having a plan, making sure that you have a plan of how you're going to reach your goals, set outcomes that are reasonable that you and your staff can actually accomplish. And then in simple terms, tell people what you're going to do. We plan on doing this in a particular period of time. So for somebody like myself, which is not a great writer, working with grant writers and different people in the administration portion of what we're doing is explaining from a nursing point of view, really what we wanted to do and planned on doing. Next slide, please. So another piece of advice that I got early on was making sure that you are presenting and proposing what you do, and that not trying to sell somebody or convince them on what you would like to do or feel like they would like you to do. But in other words, just being able to say, I work with children. I work with children that are ill. I work with children that need social determinants of health to help their parents access healthcare. And that solid recommendation, that solid case that you're making for your group or organization is really what funders want to hear. They want to hear the fact that you have a plan, that you're in that space, and that you have partners, which I'm sure most of you have now, that are working alongside with you. Being able to encapsulate that and really being able to make your case to funders is invaluable. One of the things that really, when we first started, and I look back and really kind of makes me laugh, is that people were coming to us, and I heard much of the same things. Remember, I started in our garage. Our budget was about 400,000. It is now 50 million. In a span of 15 years, we went from 400,000 to $50 million. And our budget could exceed in the next couple of years, 100 million. Because when we were talking, as Kelly told you or explained to you, is that now is the time. Now is the time people are looking for that safety net. But when people first said, oh, show data, I didn't really understand data. I was working in ER and I was working in ICU. And when I looked at data and started asking people, can you give us the data I need to write an RFP? There was so much data, I couldn't figure out what was what. So you really have to look at data that's simple and tells your story. And so there's a way to do that. So you just don't get inundated with tons of data that doesn't make any sense. And then the other thing that really just threw me for a loop was a lot of people were saying, well, tell a story. I'm going like, okay, what do you mean tell a story? Am I going to do like a Walt Disney story, or what kind of story am I telling? And, they said, no, tell a story about the clients you're seeing, what you're seeing out there that people don't understand and that people aren't seeing through your lens as a nurse. And of course, it takes practice. When I first started, I'm sure most of you see that Sarah McLachlan commercial on TV where a dog's eyes hanging out. So I was going with, stories like that and things that we're seeing. I'm not sure that people could really relate to that. It was pretty graphic and they were more like in shock, but not really ready to fund. They were like, okay, I know you're seeing this, but I'm not sure how I'm going to help. And so as I worked a little bit more with data and I really worked with storytelling, I kind of learned how to temper both and to really tell a story that means something to somebody and really having talking points that make sense as you're going for that funding. So next slide, please. So again, one of the important things about storytelling and data is making sure that you have points. I hate to say this, but almost like a politician, that you're making sure you get across. And I'll give you an example. In our incredible The Future of Nursing report, one of the items in there was talking about the year 2030. In 2030, we are going to lose 650,000 nurses. 650,000 nurses. I can tell you, and most of you can tell me, there's not 650,000 nurses in the queue to come out and take the place of the people we're going to lose. 650,000 nurses that are working today, we're going to lose. And I think especially now, the timing is right. Who are going to take care of people? Who are going to take care of people like you and I? Who are going to take care of these people that we're asking for funding? There's not going to be that infrastructure. And boy, with COVID, people can relate to that now. So having those talking points, it means something to them. And they can grasp that and say, wow, tell me more. And social determinants of health, why are they important? I'm not sure if you know, but if you look at any high school in America right now, and you took 100 high school students that are 15 years old, 14 of those 100 high school kids will not live to the age of 62. Let me repeat that. If you took 100 kids, 15 years old, many of us have children and grandchildren that are 15 years old, and you took 100 out of any class in America, 14 of those 100 won't reach the age of 62 years old. Social determinants of health, violence, access to health, you know, all the things that make us who we are as a society could really be caustic to our youth. And that's not even talking about diversity, poverty. So it is so important to make that case and to make sure that people understand that we as nurses, that's why we went into this field and that we're passionate about, we can see it firsthand. So when we talk about, you know, reporting and data and stories, they have to target somebody or something. Otherwise, they could be just passed by a lot of funders. And then the last thing I'll just hit on real quick, which starting off as a young nonprofit through the years, again, people would say you need data, you need storage, you need research. We didn't have the budget to do that. We couldn't afford to have somebody do research. We were out there providing care and services. So when the report came out, and you can see my copy of the report, I went through it with a fine-tooth comb. And when I first saw it, I thought, holy cow, how am I going to read all this? But as I started to dig into it, I realized the time and the effort that was spent on this report. And I started going back through all the appendixes and the references. And I actually picked up the phone and called the references and realized that, wow, they by themselves are partners I could partner with. I could talk to them, I could use them in a paper, I could call and say, hey, can I put your name down? And realize that there is a whole plethora of places that now I can look for funding on what I want to do in this report. And I think I heard Sue say it in a podcast that we don't want this to sit on a shelf. And I can tell you, if you take the time and go through this, it will make your case for you. So with that, again, I want to thank all you guys for being here. I want to thank, you know, thank you for the opportunity to help us work together with all the nurses to really advance us towards truly health equity. So thank you.
Thank you, Paul. Wow. So a lot of good stuff. Before I forget, I want to let you know I put something in the chat function. It's an article publication that I wrote, boy, a number of years ago now. It's the 10 R's of fundraising. It's how to raise money, and it gives you some very practical tips. So if you take that as well. I love hearing how you've used the report. Yeah, Paul, you made mention of the fact that it must have taken a long time. It was a grueling process to put this report together. It was very long in coming. I went to the National Academy of Medicine, I think I was there for 3 years altogether. It was supposed to come out in, December of 2020. And because of COVID, we elongated the process. We took an extra 6 months to really bring in issues around the racial injustices that were going on in this country, around nurse well-being, and disasters and public health emergencies. So we really took a lot of time to put this together. Thank you, Paul, Kelly, and Audrey for that illuminating and informative presentation. So what I'd like to do now is take some questions from the audience and let me see.
We do have a question in the chat, Sue.
Okay, let me come back to you here. And a question in the chat, and that is, what if you don't have an existing program, but an idea to create a program? It seems funders are less likely to support. What are your thoughts? Let me just say one thing, and I'm going to turn it over to the panel. So we are so thankful that we had representation from the Illumination Foundation and Audrey and Kelly from Blue Cross Blue Shield. If there's anything you really should know is that all foundations are not created equal. So my employer, the very largest healthcare philanthropy in the world probably, goes about deciding on programs in probably different ways than smaller local foundations, even much smaller than Blue Cross Blue Shield. So you can, I think, very easily, in my work in fundraising over the last 25 years, develop relationships with your local funders much more easily than you can, a big major foundation. But relationships are key, reaching out to those local funders, because things are handled differently in the local community. So the question, we have the, let me see. What if you don't have an existing program, but an idea to create a program? It seems funders are less likely to support. What are your thoughts? So now let me turn it over to Audrey, Kelly, and Paul. What do you think about that one? You're
Well,
on mute.
Yeah, usually I think it's just great to make the contact, to your point, Sue, whether or not you have an idea, a solid idea, but you do have an organization that is in that same health space, same health equity space, same alignment with the mission and vision of the organization. Use that contact us feature and make an appointment to meet with someone just to talk about what you're thinking about, what your organization is about. And that I think those types of things, those questions and conversations are very, very important. As Sue said, it is about building those relationships.
Yeah, and I'll echo that too. Kelly and Audrey, because the in business part of it, and again, we have to start thinking of nurses as business people, right? We can do everything a business person could do. And if there is an unmet need, and it doesn't matter if you have an organization, but you're filling an unmet need, and whether it's a city, state, county, your little town, if they're experiencing pain and urgency and they have funding, that triangle, then it is the prime time for you to step up and put your idea down on paper, maybe work with other nonprofits. And I tell you, if you make the case and you're passionate about it, there are so many funders right now. And I think Kelly, you mentioned something about it, about they're looking to fund and they have nobody to fund because they don't see programs that are really going to solve that unmet need.
In addition to that, I would say two things. The first thing is that if you take a good look at the article that Susan just shared with us, and it talks about relevance and capability. If you're an organization that only does food projects, and now you want to do a big health intervention where your staff may not have the expertise or may not have the understanding, if it's so far out of your realm, but you have the audience of people, that might be a perfect opportunity for you to form a partnership. So I would say first, you have to think about how relevant your idea is to what your organization does, but also think about, is this an opportunity for you to strike up partnerships? Our board of directors loves nothing more to see organizations harnessing their intelligence to come together and impact the communities they share.
Yeah, so that's a really good point. And taking a step back, I always say the very first thing that anybody should do if they're looking for funding is to just do that internet search and zero in on what your ideas are and how they align with certain other funders. And these days, it's not just about foundations. I said earlier, there are small private family foundations, there are banks, there's government industry. When I think you said Tara was on.
Well, I've checked the lists. It seems like she wasn't able to join.
Okay, so Tara from the federal government. So everybody has their own unique specifications, if you will. And you really need to follow the website and use words that reflect back. Foundations put a lot of effort into creating words on the internet, on their websites. So feeding back their exact words in, how you might be in alignment with them is really, really important. So there's another question here. Keep asking questions. We really need them. Here's one. We have the opposite issue, Gail said. We have a program for NAI, that's Native American Indian nursing students in North Dakota. Funders seem to desire expanding community innovation. We are having challenges to fund for nursing student education. So I think what you're saying, Kelly, is that you have some basic needs around scholarships when your foundation is looking for, to innovate. So what would you say about that, Kelly and Audrey? And then we'll get to Paul.
I'm going to give a quick story. We were contacted by Robert Wood Johnson to fund education for future nurses. And unfortunately, no one in our area was doing the programming. And I made an appointment and visited the dean and stopped and pointed on her desk and said, why don't you have this program?
Yeah.
This makes sense. Robert Wood Johnson is leading the way. You need to get it together. And so I think crossing over those lines and making those connections, and this is what was talked about in the seminar that we had in September as well. The need for there to be connections with universities oftentimes and better relationships to help them understand where they can be more helpful.
Yeah, so this is funding for nursing, basic nursing scholarships. I have another point, but go ahead, Paul.
Well, a lot of organizations will help with capacity building. There's also family foundations. There's just, it may not be a big company, corporation, but a lot of the smaller family foundations, they really understand that you need those capacity dollars. And I think our first 2 or 3 grants were to build capacity and to really bring on the people that could help you with some innovative ideas.
Yeah.
I'll
Kelly,
just
did
jump.
you want to add on? Yeah. Go
Yeah,
ahead.
I'll just jump in. There's a couple of approaches when you're thinking about nursing student education. One approach could be that maybe it is student scholarships and things like that, where that's really an internal development function within the School of Nursing or others, or it could be a way to leverage a partnership with a local community foundation or family foundation that may be able to assist with student scholarships. However, if you were to flip this a little bit and to talk more about the challenges of student matriculation and other type of special programming that has a health equity lens to it with some measurable outcomes, that could be a fundable program. I think really when you're having those conversations, really thinking about what's the true desire. Is it possible to get support from HRSA by having a specialized program for Native American students, or is it just scholarship dollars? So again, having a conversation with a funder, telling them what your idea is, and if it's lukewarm, asking them, well, what would make it fundable?
Yeah.
Those are my thoughts.
I think that's great. And I'm on the same track with you, Kelly. If you don't think a foundation is going to be interested in nursing scholarships, well, make a connection to what they are interested in. Maybe they're interested in increasing the diversity in the health professions workforce. Okay. We can do that through nursing scholarships. Maybe they are interested in developing more leaders in the community around the social determinants of health. Well, we know from the Future of Nursing report that 90% of all nursing leaders in this country, 90% of all nursing leaders in this country are white. So maybe you're going to help them with building leadership capacity in the community through diversity, through nursing scholarships. So you see what I mean? You can connect the points for them and also get what you need as well. So let's go to the next question.
Sue, actually, can I weigh in? This is Wynn.
Yeah.
So
go.
If HRSA was here, well, Tara would probably say it a lot less, a lot more, very much more subtly than I would. HRSA has a lot of funding right now for nursing education, for diversity in nursing. And not just that, HRSA needs schools of nursing and their students to be applying for these funds because the records show that many schools of nursing that need it have not been applying, nor have the students who need it, they have not been applying. And if the schools of nursing who need it, nor the students are applying, that funding won't be there in future years. So you do need to look at what HRSA has. If you're not on our distribution list, get on our distribution list. We send out their announcements when they come out, or get on their distribution list. And Jasmine, I'm wondering if when we send a follow-up, I'm assuming we would send a follow-up thank you email for joining us today. And if we do so, can we include a link or two to any of the webinars that Tara has been on with us, where she explains the funding that's available? That's one request I have, Jasmine. The other point is, on another call last week, Tara told us that the regional offices for HRSA, the operational offices, are now designing technical assistance webinars for grant writing for the HRSA grants. So get on HRSA's distribution list, see what they have, see what we have in terms of helping you create a case statement and other skills in grant writing, and that can help you too.
Okay, that is a fabulous point, Wynn. There is money to be had, but if you don't take advantage, if you don't know how to do it, figure it out, because that is the way federal government works and other foundations. If people don't apply, they think there is no interest, they think there is no need. Of course, that's not true, and that money goes away. Such a great point. So let's get to this next question. How do you recommend establishing new relationships with funders that have a by invitation only or no unsolicited request approach and are unlikely to respond or accommodate cold outreach? I'm sure staff have limited capacity to respond to everyone reaching out. I have my own way, but let's shoot it to Audrey and Kelly, and then to Paul, and then I'll chime in.
Thank you. This is a great question. And it's interesting because we've done some things that are invitation only. And I guess I would have to say networking is the way to do this, to get your story out. If perhaps you're an organization that you know fits a bill, if you can get a presentation on a panel, if you can be a part of an organization's information that goes out and shares what your group is doing and how you're accomplishing it. So oftentimes we've met different organizations when we attend different state meetings on certain topics. And there's ways that people, and now granted with COVID, it's a little harder, but oftentimes we just do meet and greets and it becomes informal and you begin to share your story with people.
Yeah. All right. So we got a few minutes, only a few minutes left, and we have lots more messages. And Kelly, Paul, weigh in on this, and I will as well.
I'll just chime in as a program staff. If there still is a contact us feature, all you're really asking for is just an additional information, maybe about timelines. And sometimes on the website, it might be invitation only because the funder is really going to uh, each year focus on a particular issue. And instead of wasting your time in you asking or soliciting, and you're not in that focus area for that year, that's why they do that. However, sometimes on websites, they will give you the roundabout date when their request for proposals come out and things like that. And so still remain open if they have a contact us feature or a phone number. Maybe you call and leave a message about how to get on a mailing list or just learn more about the organization in an effort to make a connection.
Okay, Paul, do you
Yeah,
have a
no,
hint?
yeah, because we have a real story of that happened to us and we're seeing a lot more. And to Audrey's point, we go to a lot of conventions, consortiums, and talk to individuals that we target. And that actually happened to us with Blue Shield of Northern California, because which is California, not Michigan. And their focus was on domestic violence. Well, we were trying to build capacity. So we actually went up there and knocked on their door, the office. And when I started speaking to one of actually, she was a receptionist, I said, there has to be other things that you're doing besides domestic violence because you're healthcare. And she said, well, we do education. I'm going, perfect. That's what we want to do. So we wrote a $75,000 grant for education. And now we get invited to everything else they're doing. So yeah, I would definitely recommend don't let that stop you and continue to have your goals and what you want funded out there so you could push it to as many organizations as you can.
Okay, so I'm going to give you a couple of hints too. Relationships. I don't have time to get back to people who might reach out to me in different ways. But if I know someone, if Wynn says I met someone and Sue, you should talk to this person, then I'll do it. It's through relationships. The other way to do it is invite funders to be part of your meeting. How better to give, I don't know, the word respect comes, credence, respect, and start a relationship with a funder, then inviting them to your meeting, they get to know you. I would also, once you have an area of expertise, and if you have a contact, send little snippets. We don't, we can't read long emails, but if you did an editorial, or if you did, if you got a special award in something, send little snippets. This is how we get to know you, especially in the time of COVID. And again, there are more hints in that article that I posted in the chat function. This last question before we end, do you have a list of funders? How do we get one around our area? There are things, they're not called RAGs anymore, Regional Association of Grant Makers, but that's how I know them, RAGs, Regional Association of Grant Makers. You can put in those words and get the funders in your area. And also just scoot around, put Michigan, Foundation, Health Equity. You'll start getting the funders in your areas, and know that the pharmaceutical industries, the banking industry, Microsoft, the technology industry, all these industries now are interested in funding work around health equity. So really take advantage of that. Last word from each of you, Kelly, Audrey, and Paul. Your last bit of advice in just 30 seconds.
Be bold, be brave, be creative.
Okay, be bold, be brave,
Make the
creative.
connection to health. Much like Paul mentioned in his, make the connection to health.
Yeah, and mine would be put yourself out there let people know what you're doing, be passionate, and really sell your advocacy.
Okay, wow. You guys, thank you so much for your time. I'm so happy that everyone joined us, but Kelly, Audrey, and Paul for joining us today. This has been great. I have such, if you can't tell from me, I have such a passion around this, and now I'm super excited because everybody is funding this work, and I'm super excited about it. So thank you to you, Kelly, Audrey, and Paul. Thank you to those out in the field for pushing this goal for us to achieve health equity through nursing. And as was mentioned in the beginning, if you missed a section of the webinar or would like to pass it on to a colleague, you can find the recording, a webinar summary, and any additional webinar resources. And guys, if you could also put the publication that I put in the chat function out as well, that would be helpful. By going to campaignforaction.org/webinars. And be sure to follow us on Twitter, join us on Facebook, sign up for the biweekly campaign update on campaignforaction.org. And lastly, of course, go to that National Academy of Medicine website. This report was the only report able to knock the first Future of Nursing report off of its #1 status at the National Academy of Medicine. Now this new report is #1. And the way that it gets to do that is by people visiting it, downloading the report, especially going to those recommendations in Chapter 11. So with this, I bid everyone a wonderful day and thank you so much for being here with us. Bye, everyone.